Well, there are so many questions surrounding the coronavirus. I'm so thankful we have Southern Nevada Health District Medical Investigator Dr. Whit Crosshauer to help answer some of these questions. You guys are busy, I'm assuming, with coronavirus and figuring out what's going on and potential threat to Southern Nevada. What's going on with the office right now?
Well, yeah, it's been a busy last few weeks for the entire world, for the CDC, and for state and local health departments. But yeah, there's a lot of new information coming out. There's a lot of misinformation going around. So thank you so much for having me here to help educate people.
Absolutely. So let's talk about coronavirus, this strain specifically. This is a new strain. What kind of symptoms does it produce? What happens with this coronavirus that you know so far?
So before I get into the symptoms, I want to discuss that coronavirus is a large family of viruses. There are 4 other coronavirus species that cause basically common cold symptoms. The SARS-CoV, so SARS coronavirus, is one that what people were familiar with that caused pretty severe symptoms. MERS, Middle East Respiratory Syndrome coronavirus, was another one with pretty severe symptoms. And now we have this brand new one, which is called SARS-CoV-2, and the disease that is caused by it is COVID-19.
Okay.
So a lot of information going around. But basically the symptoms there's a broad range of symptoms. Can be anything from, people can be asymptomatic, so no symptoms at all, or very mild symptoms like cold-like symptoms, to severe symptoms, pneumonia or even death. If
this is, it can cause pneumonia, or some people don't have symptoms at all, why are so many people dying from this? I mean, I guess I'm trying to make that link. What makes this so fearful? I mean, we have the flu all the time, and the flu can kill as well.
I think the biggest thing that's causing fear about this virus is that it's a new virus. So previous to, December of last year, we hadn't seen this virus in people at all. So it just was an unknown virus. And whenever we have a new infectious disease, a new virus, a lot of the fear is that we just don't know that much about it. Now, a couple months in, we know a lot more than we used to know. So we're seeing that it can have very severe symptoms. It can lead to death, but in a much smaller percentage than, for example, for SARS or Middle East Respiratory Syndrome. One of the things that is still kind of unknown is how lethal it is. So, for example, if you look at the reports of the number of deaths and the reports of the number of cases worldwide, the percentage of people who get it and then die is something around like 2%.
Oh, okay.
Yeah, so it's pretty high. But I think what is a higher probability is that there are a lot more people who, for example, in China, who may have the disease, they may not have symptoms, may not ever get tested. And so the percentage of people who are dying from this is probably smaller than what's being reported. So that's both good news and bad news. The good news is that if you get it, the chances of you dying from it are small. The bad news is that when people are asymptomatic or they have very mild symptoms, they may never think to go to their doctor, they may never get tested, they may not get isolated from other people, and so the chances of it spreading are greater. And so that's what we're really seeing in China and around the world.
It's really interesting. It's good to hear that your chances of survival are far greater than actual death. But one of the things that always concerns me, and I've always been impressed with Southern Nevada Health District, is we have so many tourists that come to our wonderful city. And now you're saying some of them might not have symptoms. I mean, is there a chance? I know that are they limiting flights or coming in, or people who can come in? But could it already be here? Could it have already been here in people who weren't experiencing symptoms? Is that something you all are looking into?
Well, there was President Trump made a presidential proclamation stating that, or limiting the number of people coming basically from China and some other affected areas. And so basically what that did was it blunted the number of new travelers we had here, people who were potentially exposed. So that probably has limited the number of people coming here. We are also getting continuous updates from CDC, the Division of Global Migration and Quarantine. So if U.S. citizens have been in China and then they travel back to Nevada, they get routed through one of like 11 airports that have quarantine facilities. Even if they were to have the disease, it would limit the contact with others. But we don't think that's what's going on right now. There's no evidence that there's community transmission of this virus in the United States, and certainly no evidence of it in Nevada.
What about testing? I know that the White House just asked for $2.5 billion, some of that for emergency kits, for vaccine, for the making of vaccine. Are these emergency kits to test for coronavirus? Are they just so expensive? Do we even have them in Nevada? How does that work?
Well, the reason why it's taken a while to roll this out is because this is a brand new virus. So I think this basically has happened at an unprecedented pace where the virus came out. They figured out what exactly is the sequence of the virus. That information was shared internationally by the Chinese researchers. And then CDC and other organizations have created tests for them. And the CDC is in the process of pushing out these tests to other health departments. It's still in process. Here in Southern Nevada, we currently do not have the capability to test for novel coronavirus. So if we were to identify anyone under investigation for coronavirus, we would basically take the samples and send them to the CDC for testing.
Oh, wow.
In the future, we will have that capacity, and the CDC will be sort of like a backup to do confirmation testing. But because this is new, it's not something that's commercially available. Hopefully that'll happen in the future, but we're not there yet.
Do we know enough about the virus yet for its lifespan? Is this something that, with the flu, we have our flu season. We know when it's coming. We know when it's hopefully going. Approximation. Do we have any sort of timeline for coronavirus?
There are a lot of sort of buzzwords going on right now. There's epidemic, there's pandemic. So epidemic basically means, we have a spread of this disease in like specific, isolated geographic regions. Pandemic would mean that we have this disease, this new disease that can cause illness that's spreading sort of around the globe. And we're not at that pandemic level yet. The word pandemic doesn't indicate severity of the disease, so just because...
It sounds bad, though.
It sounds bad, but if WHO declares that there's a pandemic, it doesn't really mean anything about how severe the illness is. It just basically means that we're seeing spread out in the community in geographic regions across the world. But so, we can't say the flu is endemic. So basically, it's always here. It gets worse in the flu season, and it sort of cycles between the north and the south hemispheres, southern hemispheres, and something that we just associate with normal life. A lot more people die of the flu every year than have died of coronavirus, which is not to downplay the severity of coronavirus. It's just to say that that is a disease that we feel comfortable with. A lot of people take it for granted that there's the flu. They don't get the flu shots. They go to work even when they think they might have the flu. So, one of the big messages we're trying to get out is a lot of those same practices that you use to protect yourself from the flu will protect you from the coronavirus. So, frequent hand washing, it doesn't just count if you just run your hands into the running water for 2 seconds, 20 seconds, soap and water. If you don't have access to that, then using alcohol-based hand sanitizer, at least 60% alcohol.
Okay.
Making sure that if you are sick, staying at home so you don't get your coworkers sick. So a lot of those same instructions we give for the flu are really the most helpful things for this new disease.
Okay, really quickly before I let you go, how many cases, do we have any corona cases in Southern Nevada right now?
We have no confirmed cases of coronavirus in Nevada.
Okay, well thank you so much, Doctor. We really appreciate all the information you've given us.
You're welcome, thank you.
All right, guys, and thank you at home for watching. Remember, you can get in on the conversation. Just follow us at City of Las Vegas and use the hashtag TrendingVegas. You can also find us on YouTube, Apple TV, Roku, and Amazon. Have a great day, everyone. We'll see you next time.